Do you have pain at the front of your knee when you climb stairs or squat? You could be having what's known as patellofemoral pain syndrome. Hi, I'm Tharani from the Physio, and today I'm talking to you about patellofemoral pain, which is an umbrella term to describe pain at the front of your knee or around your kneecap. It can be a little bit vague and difficult to pinpoint the exact location of the pain, but people often notice pain as they go up and down stairs, particularly descending the stairs. They might also have pain with squatting and running, especially downhill. And people also have pain when they get up from the chair, especially if they've been seated for long periods of time. So in order to explain why people have patellofemoral pain, I need to talk a little bit about the anatomy of the knee. So we have your thigh bone or your femur and your shin bone, which makes up your knee joint. And in front of the thigh bone, you actually have your patella or your kneecap. And that's the joint we're actually speaking about today, the patellofemoral joint. And so the patella, it's supposed to glide up and down, in and out, and even tilt a little bit as you move your knee. And this all happens very smoothly. But with patellofemoral pain, the reason we get that is because the patella doesn't glide so well and it starts to rub a little bit on the thigh bone itself, causing some abrasion and pain and even inflammation. So you might notice a little bit of puffiness or swelling at the front of the knee. And people also notice some noise, a feeling of grating or grinding at the front of the knee. And that's also a really common symptom. So why do people develop this patellofemoral pain? Often the main reason is overuse. So think about when people start to do more activity in a much shorter period of time. For example, if you start running longer distances or more frequently, the patellofemoral joint can become overloaded and start to cause pain. Similarly, people who sit for long periods can also develop this pain. So what happens is the muscles around the knee and the kneecap itself becomes very stiff from prolonged sitting. And when you go to suddenly stand up, the kneecap just doesn't glide or move smoothly on the thigh bone itself and causes pain. Other reasons include muscle imbalances around the knee or the hip, particularly your thigh muscles and your hip muscles or your gluteals. Now, when this occurs, there can be excessive movement or not enough movement at the kneecap, again, which can lead to pain. Some people might also be excessively pronating in their feet. So when they walk or run, the foot rolls in a little bit too much, which causes the knee to compensate for that, again leading to this patellofemoral pain syndrome. So if you think you might be having this patellofemoral pain, what can you do for it? Firstly, have a look at your activity levels. If you're one of those people who's actually increased their activities, it might be worth cutting back down, giving yourself a little bit more rest and recovery time. But for those of you who've been seated more and are having this pain, it's probably worth doing some gentle movement like walking and some small movements of the knee, moving it up and down on a regular basis, and some specific stretches would also help. Certainly, icing the knee is also going to give you a good relief. So you can try doing that for about 10 to 15 minutes, 3-4 times a day. And if there is a fair amount of pain, it might be even worth seeing a doctor to get some non-steroidal anti-inflammatory drugs. For long-term relief, the best thing is to see your physiotherapist who can identify any underlying reasons and also do a proper assessment of your whole kinetic chain so they can see if there are any imbalances around your hip, knee or ankle which might be contributing to the pain itself, and give you some very specific advice and exercises. They can also provide some treatments such as joint and soft tissue mobilization and even taping to speed up the recovery. So if you have knee pain, don't sit around and wait for it to get better on its own. Speak to your physio and get some timely advice. Thanks for watching. Please don't forget to subscribe to our YouTube channel, hit the bell icon. See you next time. I'm Tharani. Bye.